Hi everyone, my name is Kristen Joseph and I am an occupational therapy student at Bay Path University. My final research proposal was on mindfulness and occupational therapy intervention for individuals with eating disorders. I chose mindfulness as the intervention because I actually engage in mindfulness techniques every day. Personally, it allows me to think clearly, and it is something that has always been an interest of mine. I chose the population of individuals with eating disorders because I have actually suffered from disordered eating in the past, and it's just something that, I have to deal with every single day. And in general, I'm very curious about researching different eating disorders and how it affects people. Yep, that's my topic. So there is actually a pattern for individuals with eating disorders and high levels of stress. Studies have actually indicated a link between stress and eating disorders that is actually similar to the relationship between stress and drug addiction. It is suggested that stress can have an effect on the common neuronal circuitry that is not only involved in drug addictions but also eating disorders. There's many different types of daily stressors that often lead to disordered eating. This could include pre-meal anxiety, social appearance anxiety, or even just chronic stress and trauma, which could be the loss of a family member or a friend, spouse, emotional, physical, or sexual abuse. And these daily stressors can often lead to disordered eating, which can be a huge barrier to occupational therapy treatment as well. The purpose of this study is to gain a better understanding of how exactly mindfulness techniques can impact stress levels in individuals with eating disorders. When an individual is seeking occupational therapy services regarding an eating disorder, the stress can actually negatively influence treatment. So it's very necessary to address this stress, which could potentially be done by incorporating mindfulness techniques in practice. Many studies have linked stress management with mindfulness, and this study would be a randomized control trial in order to understand the effects of mindfulness intervention in individuals with eating disorders compared to those who did not receive the mindfulness intervention. And I created this slide to shed some light on mindfulness techniques and how it can help with managing stress. So, mindfulness is a process that develops awareness within an individual regarding physiological and psychological changes. There are 3 elements that involve this process, including development of tolerance towards uncertain life changes, reducing automatic behaviors, and immediate criticism of the individual's self, other people, and situations. And there's many different characteristics that are also included in mindfulness, and this includes non-judgmental attitude, acceptance, patience, trust, openness, a let-go attitude, empathy, generosity, gratitude, and kindness. And these elements can actually be very successful when incorporated in occupational therapy intervention. As we all know, occupational therapy is very focused on client-centered care. And in order to give client-centered care, we must be developing and forming a very close and personal relationship with our clients so we can better understand them and understand what intervention would be best for them. So this research design will actually follow a randomized control trial design. So there will be 2 groups, a control and an experimental group. The participants in the experimental group will receive mindfulness-based stress reduction sessions prior to occupational therapy interventions for eating disorders, whereas the control group will not be receiving the mindfulness-based stress reduction sessions. The experimental group will actually undergo mindfulness intervention 3 times a week for a 6-month study period. These sessions will last 20 minutes and will not be an additional expense to the participants. Prior to participating in the study, all participants will be asked to provide written consent as well. So this slide actually outlines the basic criteria for being eligible for this study, and in addition to that, the experimental group will undergo yoga as a part of intervention, so it's important that every participant in this study has not practiced any form of yoga 6 months prior to the study. participants will also not be allowed to begin taking new medications anytime during this 6-month period. And this slide describes the scale that will be used in order to study the variables in this study, which is the perceived stress scale, that is the instrument. In addition to this information, evidence has been found to establish the validity and reliability of this scale. When the scale was created, good internal consistency reliability was found, and retest reliability over a 2-day, 6-week interval. And finally, a t-test will be used to compare the means of both populations, which is the experimental and control group. If the null hypothesis is rejected, then there is no correlation between the experimental variables within the study, which would be the type of intervention the individuals underwent and the amount of stress levels they were experiencing. And in order to reject the null hypothesis, the t-test must conclude that the p-value is less than 0.05.